Welcome to our webinar series, Ministering During the COVID-19 Crisis. Today, we're looking at keeping your children on track in the COVID-19 disruption. And we have with us Ms. Robyn Ezzell. She's a child psychologist in North Carolina, where she works with Two Paths Crossing. She is a Tar Heel, graduated from UNC, University of North Carolina at Chapel Hill, and then got her master's degree there at Georgia School of Professional Psychology. So thank you for joining us today, Ms. Robyn.
Thank you for having me, Pastor Eddie.
So this is a tough time for a lot of parents and a lot of kids. There's a lot of information out there about COVID-19 and its impact on mental health. And there are even some folks that say it could continue to be an impact for years to come. I know you naturally work with children on a daily basis, but it's been a little bit different working with them during COVID-19, hasn't it?
It has. It definitely has. There's been a transition that we have noticed that in the beginning, there were some kids who had a challenging time being able to stay home. And then there were some kids who absolutely loved the idea of staying home. As the weeks proceeded, it was definitely became more of an issue for lots of people, not just being at home all the time and away from school, but also the lack of social involvement and the stress that they encounter when they're around their parents who are also dealing with financial and psychological stressors during this time.
And so parents looking at their child, and there's some of these natural difficulties. Today we're going to talk a bit about what they can watch for, the kind of behavior changes they want to pay attention to. But this is not impacted, as you kind of alluded to there, all children and all teenagers don't respond the same way, do they?
No, they do not. And it really depends on the pre-existing types of mental health issues that they may have had before and how they dealt with difficult times in their lives. Some of them may be angry, some of them may be tearful, some of them may be withdrawn. And so it really is important to determine what type of issues are causing their stress and what they're thinking and feeling in order to be able to proceed with treatment.
And so things that parents want to look for, they're just some common changes they want to watch in their children, aren't there?
Yes. We have excessive crying and irritation in younger children, and this is beyond what you would typically recognize in younger children. So, it's not just they can't have a toy and so they're going to be, upset and tearful. This is being tearful without there really being a reason for it or no underlying cause that you're aware of. Returning to behaviors that they had outgrown, for example, toileting accidents, bedwetting, separation anxiety, things that you thought they had been able to accomplish, but they've regressed back to those behaviors. Excessive worrying or sadness, unhealthy eating or sleeping habits. This would be eating too much or too little, sleeping too much or too little. And again, this is beyond what would typically be seen in children and adolescents. Irritability, acting out behaviors in teens, the poor school performance or avoiding school. With the online school, this has definitely been a big issue for those young people who don't want to participate in online or really need that social interaction in order to be successful in the education environment. Difficulty with attention and concentration, avoidance of activities enjoyed in the past. And again, we're not talking about an inability for them to go and play basketball at the local gym. We're talking about things that they would have normally done around the house for enjoyment that they are no longer doing. Unexplained physical kinds of symptoms, and also the use of alcohol, tobacco, and other drugs.
And so you see some of these actions, some of these behaviors in your child. There are some things we can do to support them and help them out as well, aren't there?
Yes. Mm-hmm. The big one is to talk to your child or your teen about the COVID-19 outbreak and being able to help them recognize, what it is that they're thinking, what kind of information that they know. And the big thing here is to not plant seeds in their heads, find out the information that they know and then talk to them about, how they feel about that information.
And really, the scripture is a good thing to think of here, the right kinds of words, fitly spoken, as the Proverbs say, and then to think about what your child needs as far as facts and not blowing things out of proportion, isn't it?
Yes, absolutely. The big thing here is sharing the facts. What are the facts that you need to share with your child? How, depending on their age, depending on their developmental capacity, you want to be able to give them information that's going to be healthy for them and not information that's going to hurt them or make them worry more.
And so we can reassure them and help them to feel safe. It's a good way to point out that the Lord is with them. Talk to them about their spiritual condition and how the Lord is with them no matter what difficulties might come our way. And then some other ways is talk a bit about how they can protect them from the media exposure and so forth out there.
Right. So the media is definitely a huge impact on young people and adults as well. So anything that a parent can do to limit the amount of information that they obtain from the media and giving them information that you provide for them, because then at that point you're able to filter what is appropriate for your child to hear. And it doesn't, like I said before, increase the anxiety level for information that they really don't know or information that has been skewed in a way to make it more dramatic.
Mm-hmm. And to keep the routines is a really important thing as well.
Yes, as much as possible, trying to keep some sort of routine. That's one of the things that I've encouraged lots of parents to do recently, is to even write down a list of what we're doing, just like you would have in school from, 8 to 9, this is what we're doing, from 9 to 10, this is what we're doing, this is when we'll have our lunch break, our outside time, because kids really thrive on knowing what their schedule is. And in a time when we have so many things that are unpredictable, being able to predict their schedule and know what they're going to be doing throughout the day is extremely important.
Great. And so routine, big deal for parents, big deal for children. We can see in the scripture, Jesus seems to have had a routine as well. And then as part of that, just having those conversations day in and day out. Talk to us a bit about some of the principles for talking to our children.
Well, the big thing is that you want to have age-appropriate conversations. So you don't want to give information that the children are not going to be able to understand, and that, again, is going to plant seeds that are going to increase their anxiety or fear of, the COVID-19 in general, or of people in particular that may have some exposure to COVID-19. So really choosing the words that you want to say to them, like for the younger ones, very concrete kinds of things like, we're here, we're going to take care of you, you'll be okay, we're going to be okay, definitely acknowledging that for the children that their parents are going to be okay, because that's a big one for this age group, is making sure that their family is going to be okay.
And you talk about like ages 8 to 11, kind of giving them some nuts and bolts, explaining the mechanics of the situation. And then those older kids can handle a little bit more information, can't they?
Yes, and giving them more information, because between the ages of 12 and 18, they also can share information with their peers. And at that point too, they're also practicing a sort of independence. And so you want them to be able to protect themselves as much as possible with, appropriate hand washing, social distancing, and education.
And folks may wonder, well, when can we do this? We do get some guidance in the scripture, Deuteronomy 6, when you get up in the morning, when you go along the way, when you go to bed at night. Again, here's routine, but there really are times all throughout the day, and especially if we end up being quarantined again, when they can talk to their children, whatever their age may be, about these particular situations. And then another general principle, talk to us about being calm and being reassuring to our children.
So that's definitely important when you're talking about how an adult or a parent, even a caregiver, reacts around children, because they're going to pick up on how you feel. So if you're presenting a situation to them and it's very calm and very factual and presenting in such a way that the child or adolescent knows that you're in control, they're going to feel better about the situation. If you present it to them in such a way that you're extremely anxious and you're becoming depressed because of the social isolation and the quarantine, then they're going to pick up on that as well. So being very mindful of the fact that children oftentimes mimic what they see in the home as far as emotional coping strategies.
Mm-hmm. And the passage that comes to our mind is Matthew 6, where he talks about not worrying so much about your life and what you eat and drink, and gives us the examples of the birds and how the Lord takes care of them and the flowers and so forth. And so we can point them to those kinds of scriptures. And you're talking about really modeling that faith, modeling that we feel like we're going to be okay, and even having a bit of a merry heart, as Proverbs 17 says, as we go through some of these times. It really does help our children. They learn from what they see as well.
Mm-hmm.
Some more general principles. You've talked about age-appropriate conversations, being calm, and then just being there, being available to speak to their children is really critical as well, isn't it?
Yes,
being there.
Mm-hmm. Being able to talk to them and answering their questions. And, what I've also seen a lot is parents having scheduled question answer times. So, like every afternoon at 5:30, if kids have questions or concerns about their feelings or friends or families, that they can sit and they can talk about it. So that allows them an opportunity to know that there is a time when this is going to be expected. Parents are going to just completely focus on them during this time. And that also gives parents a way of being able, if they're in the middle of cooking dinner, for example, and the child has some sort of question or comment, definitely for them to be able to say, okay, I'll get to that question in just 1 second, give me a minute, or, we have our question answer time, that kind of thing. So definitely making yourself available to listen and to talk as much as possible.
And then to avoid language that might blame others or lead to stigma. This can turn into a big problem as well, can't it?
Yes. And what we've done in our home, and I've also encouraged other parents to do, is, instead of blaming others or picking out a certain people in the population to be fearful of or spreading it, to pray for everybody so that they recognize that, everyone needs our prayers right now, not just the people that are most at risk, but everyone during this particular time. That's
good. And then to pay attention to what kind of messages they're picking up or hearing on television or radio or online, because they can be listening to things all on their own, which can be creating difficulties if we're not careful as well.
Mm-hmm.
And then you talk also about reducing the amount of screen time. How do we go about that as parents when, especially if we get quarantined again, there can be this isolation and so forth that's happening with our children?
I think if you focus on the schedule that we mentioned earlier, being able to give them time to have with their friends, if it happens to be online or through, social media apps where they can chat with their friends, that kind of thing. But in creating that as part of their schedule so that they know that from morning until night, they're not being bombarded with information from, newscasts or, friends or, in general, the social media information that's coming across the pathways for these kids. So limiting their access to technology in general and making yourself available when they are actually engaged in those types of online activities. That way, the information that they are going to be susceptible to.
And then there's all kinds of information they get on the internet or social media, stories and rumors. And so we want to come back and to be able to give them accurate information and try to knock down some of those inaccurate rumors that might be out as well.
Mm-hmm.
It's a good opportunity, though, to teach everyday actions to reduce germs, isn't it? So share with us a bit about that, because some parents are thinking, my kids are so young. This can be some hard lessons here.
It can be, and it's really how you approach it with them, and being mindful of, hand washing and staying away from people that are coughing or sneezing or sick. Making sure that if you're coughing or sneezing, that you're doing it in your elbow, and discussing any kind of actions that may be taken at school or in public to be able to help kids to keep themselves safe. And I've noticed as well that with this, with the new social distancing and the encouragement to wear a mask, that if parents are on board with it and supportive of it and making it something that, is sort of an everyday principle in their lives, the kids are totally fine with it. The parents who are resistant to it, again, the kids are going to be resistant to it. So, teaching them and allowing them to be able to follow in footsteps of parents that are guiding them appropriately to keep themselves safe.
It's great. So they really do learn from our model, and this can be an opportunity as well to teach just good hygiene. We probably needed to have been washing our hands a lot more and more effectively. You talk a bit about that as well here, how they hand wash and how to turn that into a good habit.
Yes, and this is very interesting because I've heard a lot of different people talk about how to get kids to hand wash and things like that. But, definitely having some sort of little song that they can sing so that they're hand washing enough and making sure they wash completely their hands. The happy birthday song twice is what we've been given as far as the rule of thumb. Singing it through twice is a good time frame for being able to wash. And again, if you're washing your hands, your children are going to be washing their hands. And out in public, hand sanitizer is everywhere. Encouraging your kids to use it. Have some on yourself so that you can, give them some hand sanitizer if they happen to be out and about and having to touch things that may have been touched by someone who was exposed.
And the stickers at the bottom of the screen come from the CDC, so people can print those, can pass those out. They're thinking more about schools probably with that, but that's something that all parents can do just to reinforce the importance of hand washing. And then talking to them about how to protect themselves from getting COVID-19.
And this goes right along with, maintaining healthy practices both at home and at school and when you're out in public. Making sure, again, that you are coughing or sneezing into a tissue or your elbow, keeping your hands away from your mouth, nose, and eyes. This has been a really tough thing for lots of kids because young kids especially, they're biting their fingernails or they're rubbing their eyes. I've got some things that I give out to kids to keep their hands busy so that they prevent themselves from being able to touch their hands. They've got something to keep their hands busy and working. If you don't have soap and water, again, asking for some type of hand cleaner, and even educating them about things that before they may not have worried about, like desk and doorknobs and light switches, and just making sure that they are keeping those areas clean, as well as if they're feeling sick, just to stay home.
And they could, we want to prepare them if they did get COVID-19. So how to handle that should one become ill with COVID-19.
Right. So the biggest thing here is to make sure that if a child does contract the illness, that they understand that they're going to be okay, and that it's the parent's job to make sure that they are receiving the appropriate treatment for them. So, from what the doctors have said so far, most children don't seem to get very sick. Adults seem to get a lot sicker. And if children are having the knowledge of how it affects adults, then they may be thinking that they're going to have similar types of reactions to it. So making sure that they know. If you do get sick, it doesn't necessarily mean that you have COVID-19. That has been a huge concern for lots of young people. If they start coughing or sneezing, or if their chest starts hurting, or, they wake up one morning and, their eyes are itchy, they're worried about COVID-19. And so, what's important to remember is that there is a test, and just because you have you're sick doesn't necessarily mean that you have COVID-19. So,
Mhm.
and making sure that if you suspect it, or if your child's been exposed or has some risk factors, that you have them to see a medical professional as soon as possible.
And so they could get it. It wouldn't be the worst thing if they did, and then we would just deal with it.
Right.
And with the parent and healthcare professionals work through that and help them through it. You provided some further tips here about social distancing and so forth that we can think of as well.
Mm-hmm. The first one is really important. Social distancing does not mean social isolation. So with the technology that we have today, there's still many ways that people can maintain social interaction and not necessarily be in the same proximity as their friends or family. So making sure that we take advantage of that technology, and, even taking them places or driving by where they can wave to their friends, that kind of thing. Increasing the children's self-efficacy, so having them to become more independent and more mindful of what they're doing to keep themselves safe. Creating opportunities for caregivers to take care of themselves. That's huge, again, in light of the fact that many children are going to react in ways that their parents react. So making sure that as parents and caregivers, we are doing what we need to do to make sure we're staying healthy, both psychologically and physically. Seeking professional help if children show signs of trauma that do not resolve relatively quickly. And again, this is going to be above and beyond what you would typically see as a reaction to something that was traumatic in their lives. Emphasize strengths, hopes, and positivity. This is also a big thing that not only, caregivers and parents can do, but anyone, making sure that you focus on the strengths and hopes and positivity, the things that, that God's given us to be able to deal with crises such as these. And if we can do that, then that definitely helps our children.
That's great and really good information. And you provided some other sources and some resources here. If people email us at questions@nafwb.org, we'll send them a PDF of the PowerPoint. And I think if they select these particular, what's underlined, they'll be able to get to the hyperlink. But these are some really good resources here, aren't they?
Yes, absolutely. And this focuses on, not just taking care of yourself, but it also gives, fact sheets for grandparents and helping families to cope, and, talking about the coronavirus and why people are wearing masks, keeping kids busy. So there is a wealth of information here. A lot of stuff has been coming through recently with research that's been helpful for lots of people. And so take advantage of what you can, and just make sure that you get it from a reputable website so that the information that you are relaying is going to be accurate information.
And really, the more information they have, the tendency is to be calmer and to have a better understanding of how to deal with it. It really does help us to deal effectively with this particular crisis, doesn't it?
Absolutely. Yes.
Well, thank you, Ms. Robyn, for sharing this information with us today. Thank you all for those of you who've been able to join us. We encourage you to email us at questions@nafwb.org. If you do that, we'll send you a link to complete the webinar satisfaction seminar. We'll also send you a PDF of this PowerPoint so you can hold on to that and go back and use that at your leisure. And then take advantage of some of the other information we have. If you haven't liked the Better Together podcast, please do that. And there's many podcasts like this one that you can go and listen to. Also, if you're not a subscriber yet to the NAFWB YouTube channel, go and subscribe to that. And there are many videos that you could go and look at and could help you. And then if you have a topic you would like for us to address, please send that to us at questions@nafwb.org. Well, Ms. Robyn, we thank you for taking the time out. We pray for you as you continue to work with children today, that God will continue to be with you and bless you and use you. And thank you for taking the time to help us to more effectively minister to and help our children today.
You're welcome. Thanks for having me.
You bet.